to the future of pharmacy, to the ever-increasing chemotherapy preparation sites, and to all the clinical and nursing fields, we want to bring safety. A drug preparation cabinet completely reborn and designed specifically for high-risk drug preparation. We present to you the Meteor 3. Did you know that conventional safety cabinets cannot fully protect pharmacists from being exposed to anti-cancer drugs? There have been numerous reports of anti-cancer drug leakage, where not only pharmacists were exposed, but so were nurses who administered the medicine prepared in a contaminated infusion bag. Instructions to medical institutions by the Health, Labor, and Welfare Ministry state safety cabinets with a closed connection device be used, while priority is that pharmacists and nurses engaged in chemotherapy are protected from exposure to anti-cancer drugs at all costs. But did you know that conventional safety cabinets cannot completely prevent anti-cancer drug leakage? At a certain large hospital's pharmacy we investigated, the anti-cancer drug fluoroaerosol that should not be detected was indeed found in many places, such as a vent hole, beneath the cabinet, prepared drug storage box, and so on. We also detected a high concentration of anti-cancer drugs in on-call doctors' rooms. This suggests unsuspecting staffs may have been exposed as well. Highly toxic carcinostatic drugs prepared in a safety cabinet can leak. The fear is immeasurable. And medical professionals at the front line of treatment are at risk of being exposed. 1 out of every 2 Japanese people develops cancer, and the number of people who receive chemotherapy is ever increasing. Ambulatory treatment for chemotherapy has become common. In turn, the amount of such drugs handled by pharmacists has and is expected to increase on an annual basis. Advancement in carcinostatic medicine made it possible to alleviate side effects, thereby reducing risk and burdens imposed on patients. Ironically, this has increased the risk of medical professionals unintentionally being exposed to such medicine. Toxicity of commonly used anti-cancer drugs is not only acute, but they are also known to cause chronic effects. Female pharmacists and nurses in particular are even more susceptible to the effects of exposure to such substances. Infertility and spontaneous abortion are 2 such examples. Therefore, medical institutions should do everything in their power to contain such hazardous environments. As more women join labor force in today's Japan, relocating young female staffs to another department within the hospital will not be sufficient, as this only puts yet other female staffs at risk. Let's see how anti-cancer drugs leak. First, the substance is withdrawn from the vial. Then, the needle is extracted from the vial. This is when leakage is most likely to occur. Here is an enlarged view. Aerosolized particles of the highly concentrated drug splash around the bevel. Here is an image of the interior of a contaminated cabinet. As a result of repeated preparations, a small amount of potent and cytotoxic drug adheres to the surfaces and accumulates over time. Even a small amount will retain its potency and toxicity for a long period of time. Anti-cancer substance spreads throughout the interior. This poses a serious threat to the medical professionals working at and around the cabinet. Moreover, extracting and inserting one's hands further spreads the substance even outside the cabinet. Also contaminated is the exhaust pipe, and the contaminated air is continuously discharged through the exhaust fan to open air. Now you can see a potential danger of continuously using such a poorly designed cabinet. Sadly though, professionals had no choice but to rely on such a hazardous piece of equipment. Now let's take a look at the Meteor 3's astonishing decontamination capability. The Meteor 3 incorporates newly developed anti-cancer absorption filters at two locations, the circulation side and discharge side. These filters help keep the cabinet safe by capturing the drug substance and dust particles. Our Class A Type A2 Meteor 3 is equipped with two filters, the first of which absorbs anti-cancer substance volatilizing in the work area, while the other captures the exhaust air containing the substance exiting to the exterior of the room. Safety made possible by the use of ozone gas, even outside operations. At night, the Meteor 3 releases ozone gas into the airtight chamber of the cabinet. The ozone gas circulates inside the cabinet and starts decomposing anti-cancer substance. The exhaust side filter is sealed by a valve, and humid and highly concentrated ozone gas fills the cabinet to promote decontamination. As you can see, the cabinet has been decontaminated. Let's take a closer look inside. Highly concentrated ozone gas circulates the airtight cabinet. The circulating ozone gas cleans even microscopic amounts of anti-cancer substance adhered to the cabinet as a result of daily operations. Even the substance captured by the filter is decontaminated by the circulating ozone gas. This automatic process ensures that medical professionals working by the cabinet stay safe. The same ozone gas also circulates during operations to disinfect the cabinet. Sensors installed on the cabinet monitor ozone gas concentration and leakage. As you can see, our state-of-the-art Meteor 3 ensures the safety of medical professionals. Let's take a look at Meteor 3's another major feature, ozone water decontamination. The Meteor 3 comes equipped with an ozone water sink. An infusion bag containing prepared drugs is inevitably contaminated. The Meteor 3's ozone water, at a concentration of 4 ppm, can decontaminate 3 or 4 of such bags within 2 to 4 minutes at a time, protecting pharmacists and nurses alike. The sink is positioned for easy access. In case of spill or leakage of drugs, you can prevent it from further spreading by wiping it with the ozone water in the sink at the high concentration of 4 ppm. Now let's take a look at some of the other great features of the Meteor 3. Touchscreen for easy operations. Inflatable seals to ensure airtightness of the cabinet. Automatic shutter. Automated humidifier and air tightness monitoring sensor. Ozone sensors inside the cabinet for leak detection. Finally, a preparation recipe display, as well as a work table for easier operation will be added in the future. At the Osaka International Cancer Institute, one of the most renowned cancer treatment institutions in Japan, decontamination is performed automatically thanks to the Meteor 3's superior capabilities. To protect your medical professionals with the world's first technology, designed specifically for high-risk drug preparation, please consider the Meteor 3.